Patient is asked to turn against the wall and push the wall. Now we'll check for the range of motion. First, the patient is asked to keep their hands backward on the head and push the hands backward. This is shoulder abduction and external rotation. Now they are asked to take their hands backwards as much as they can. This is shoulder internal rotation. Now, active flexion of the joint, active extension of the joint. Then, active abduction of the joint and active adduction of the joint. Then, active external rotation of the joint and active internal rotation of the joint. Now we passively perform all the motion. Passive flexion, passive extension, passive abduction, passive adduction, passive external rotation and passive internal rotation. We'll also check for crepitus end. Now the patient is asked to stand backwards. We locate the angle of the scapula and tell them to raise the hand. Now we'll palpate the shoulder. First, we'll check for temperature change. Then we'll start from the sternal notch and palpate the clavicle, the acromioclavicular joint, the coracoid process and the head of the humerus. Then we ask the patient to turn back and we palpate the spine of the scapula and the borders of the scapula. Similarly on either side to see the alignment. Now we perform Ampi-Can test. This is the position of the hand which the patient is asked to keep. We'll push the hand and they are asked to push it against our hand. Now we'll perform painful arch test. We'll passively adduct the hand and the patient is asked to take down the hand smoothly down. Now we perform external rotation against resistance. We apply resistance and the patient is asked to push against resistance. Similarly, internal rotation against resistance. They are asked to push our hands.